It is really critical that eye care professionals start thinking about acting on myopia and doing myopia management. There is technically a tsunami of myopia that's coming our direction, and half the world's population is predicted to be myopic by 2050.
It's our duty to educate our patients, and myopia management, if you're not educating your patients, then you're doing them a disservice.
I think now it's absolutely essential to be involved in myopia management. You're a first responder to an incident. So a child comes to you, you diagnose myopia, and you want to involve them and their family in myopia management because it'll make a huge difference to the rest of their lives. The COVID lockdowns have definitely impacted myopia. I've talked to children in the clinic and they've admitted that they've had to spend days upon days continuously indoors with no outdoor exposure at all. Now clearly that's bad for their myopia, and I think the consequences will be significant.
So the clinical evidence to support myopia management shows that they are effective at reducing the incidence of myopia by spending time outdoors, but also the interventions that are now available, they actually are shown to reduce the progression of myopia.
Getting started with myopia management is really easy. It's about you having a conversation with a parent and a child about the potential of a child becoming myopic, or a child who is myopic, what we can do to help maintain the good health they have now into adulthood and later on in life.
I think it's really important that you make sure that you communicate in a way that's understandable for that individual patient. So make sure you have a different approach depending on the patient's education background or their needs.
I think addressing parental concerns is obviously important. Being honest, feeling that you can share the data, pointing them in the direction of educational sites that are designed for parents and children.
We've been doing myopia management in our clinic now for the past 12 years, and it has single-handedly been the biggest growth area that we've had year on year.
I think ECPs should look at myopia management as not an intervention to affect the eye, but an intervention to stop the eye being abnormally affected by environmental factors.
For eye care professionals not doing myopia management at the moment, the World Council of Optometry have mandated that myopia management should become the new standard of care.
I think as ophthalmologists and as optometrists, we have a duty of care to make sure we're doing everything possible to generally improve the eye health of the society.